For literally millennia, humans have been trying to understand and treat the troubles of the mind. Some early Neolithic societies believed that mental illness was caused by spirits that had invaded the head. To treat this ailment, healers would drill a hole into the skull of the patient to release the spirit in a practice known as trepanation. Now, this may have actually relieved pressure from inside the skull as well as the headaches it was causing. The earliest evidence of trepanation comes from the skull of a 50-year-old male who survived and healed from the surgery. This happened in Ukraine about 6,000 to 7,000 BC. Trepanation was also the preferred method for releasing mind spirits in ancient Egypt. Psychological and physical illness was seen as essentially the same thing, and when people became unwell, it was thought that they had been possessed by spirits. Priests assumed the role of physician and vice versa, but despite their supernatural beliefs, physicians such as Imhotep recognized that illness and the healing process could be better understood by observing the results of the treatments that they applied. This was a very early form of empirical science. Through observation, the function of the heart and the muscles were deduced, and it was recognized that the brain and the spinal cord were integral to the functioning of the nervous system. Like the Egyptians, priests in ancient Greece would also perform healing rituals to cure people's ailments for a fee, and a number of ancient Greek physicians also used empirical observations to understand how the body works. Hippocrates observed contralateral control, where the right side of the brain controls the left side of the body and vice versa. Hippocrates also proposed that the body balanced four humours: blood, yellow bile, black bile, which doesn't actually exist, and phlegm. These humours were thought to correspond to the four elements: air, fire, earth and water, and also to control our personality. So a sanguine person was supposedly dominated by blood and possessed an even-tempered, jolly personality, whereas a phlegmatic person was apathetic and sluggish. What was revolutionary in this thinking is that Hippocrates saw illness, both physical and mental, as having physical rather than supernatural causes, and so they could be treated by physical interventions. Too much or too little of these humours was treated by interventions such as bloodletting, vomiting, rest, exercise, and a healthy diet to restore balance. One of Hippocrates' more curious ideas was hysteria, a female ailment that was supposedly caused by a wandering womb. According to Hippocrates, Galen, and other male physicians, if a woman did not engage in intercourse, then the uterus would become misaligned, causing a whole host of symptoms such as anxiety, irritability, and insomnia. Even more bizarrely, doctors would treat hysteria with genital massage to induce paroxysm, which would leave women feeling much better. But bringing a woman to paroxysm was seen as tedious and difficult. Dr. Nathaniel Highmore reported in 1660 that it is not unlike that game of boys in which they try to rub their stomachs with one hand and pat their heads with the other. And with so many women wanting this treatment, in 1880, Dr. Joseph Mortimer Granville developed the first electronical vibration device to speed up the process and save doctors' sore hands. Now, this practice remained completely socially acceptable for literally hundreds of years, even among the social elite, because it was just accepted by these men of medicine that the fairer sex was simply unable to feel arousal or sexual pleasure. Hysterical! Get it? Yeah. Although many Hippocratic ideas such as bodily humours and hysteria have since been disproven by medical science, it was clear that his philosophy of health and illness was firmly seated in the biological tradition, where physical and psychological disorders were seen as having biological, not supernatural causes. But come the Middle Ages and the early spread of Christianity, all of this was about to change. The church saw illness, and particularly mental illness, as the result of being cursed or possessed by demons. In the Gospel of St. Mark, Jesus returns a man to his senses by commanding, "Come out of this man, you impure spirit," And so church leaders touted supernatural methods like exorcism as a legitimate means of healing. St. Francis of Assisi is said to have cured a man of the sacred disease, known today as epilepsy, through Eucharistic ritual. We know now that grand mal seizures subside of their own accord, but to observers at this time, it's understandable that onlookers would have attributed the man's temporary symptom relief to the actions of St. Francis. But the treatment of mental illness in the Middle Ages was not always as harmless as being fed a piece of bread. People with Tourette's syndrome, mood disorders, and schizophrenia were physically restrained, burned, had their heads shaven into cross shapes, starved and beaten. And these so-called treatments weren't just reserved for people with genuine illness. Demonic possession became a convenient excuse to lock up and torture anyone who was socially undesirable, like heretics, thieves, or women. The barbaric treatment of mentally ill people continued well into the Renaissance, despite the influence of great thinkers like Descartes, who theorized about the structure of the mind, and Da Vinci, who dissected human bodies to understand and record how bodily systems worked. Witch hunts were all the rage at this time, and although some people labelled as witches were likely to be mentally ill, strangely, insanity was actually one of the few accepted defences against these charges. By the 16th century, Western Europe needed some way to cope with its increasing population of poor people who were assumed to be mentally unwell. At this time, lunacy, as they called it, was seen as a lifestyle choice that could be disciplined out of people. So the gentry wanted to segregate these undesirables from proper society. And so governments began to establish asylums to house, treat and study people with mental illness. Of course, the upper classes could also pay an admission fee to come and gawk at inmates for entertainment. Asylums like the Bethlehem Royal Hospital, famously known as Bedlam, continued to use humoral therapies such as bloodletting, vomiting and blistering, but these were intended more as a punishment than a cure. Right up until the late 18th century, inmates at St. Luke's Asylum were viewed as barely human, and so it was thought that there was little point in treating them kindly. Instead, standard practice was to beat these beasts into compliance. Atrocities that were widespread in public asylums included physical and sexual abuse, patients being chained to walls or chairs, being muzzled, whipped or hosed. Some patients were prevented from accessing clothing, and all endured significant overcrowding and disgusting living conditions. One report from an asylum in York describes a cell 8 foot by 8 foot, inches deep in excrement, that was housing 13 elderly women. It wasn't until the late 18th and early 19th century that asylum philosophy shifted. Moral therapy was introduced, the revolutionary idea that if you treat mentally ill people with kindness and respect, they might feel better. So-called melancholics were separated from maniacs, and therapies such as reading, music and pleasurable activities were prescribed depending on the person's symptoms. Unfortunately, it was clear that in many state-run asylums, underfunding, understaffing and lack of staff training meant that the good intentions of moral therapy were rarely put into practice. But in some asylums at least, physical discipline was banned, and a number of caretakers were even dismissed or brought before the courts to answer for the brutality and manslaughter that they'd committed. The 19th century also saw the origin of psychological models of psychotherapy. In essence, psychological approaches see mental illness as having psychological roots, problems like dysfunctional beliefs and thinking habits. Anna O was a 23-year-old woman who was referred to Viennese physician Joseph Breuer with partial paralysis, difficulties in speaking and impaired vision. Anna O would also go into what Breuer described as a self-hypnotised state and was later forcibly committed to an asylum. Her symptoms had no obvious biological cause, but their onset did coincide with the death of her father. Breuer diagnosed Anna O as hysterical, but instead of the usual genital massage therapy, Breuer encouraged Anna to talk through her thoughts and feelings relating to the troubled times in her past. This talking therapy reportedly helped her symptoms subside, and on the 7th of June 1882, the 12-month anniversary of her committal, Anna O checked herself out of the asylum. Unfortunately, a month later, her symptoms returned and she was readmitted. Hospital reports also suggest that Anna O continued to rely on morphine to manage her symptoms. Breuer's protege, Sigmund Freud, believed that Anna O's hysteria was in fact caused by repressed sexual urges and began to develop his own revolutionary theory, psychoanalysis, which we'll discuss next time. Thank you for watching. Today we've learned about how the treatment of people with mental illness changed from the Mesolithic to ancient Egypt and ancient Greece, right through to the European Middle Ages and into the Renaissance. We saw the birth of insane asylums, the rise and fall of moral therapy, and the early origins of the psychological model of psychopathology. In the next video, we'll take a closer look at how asylums, psychology, and the treatment of mental illness changed in the 20th century and beyond.